the time of year when lots of people get out and enjoy the sun. But with that comes the risk of sun damage. Here to elaborate is Dr. Thomas McGovern with Fort Wayne Dermatology Consultants. Now, obviously skin cancer is what comes to mind first, but there can be other harmful effects caused by the sun, right?
Oh, certainly. In 1% of the time it takes you to get a sunburn, you can start changing the skin so it starts to wrinkle. Also, people get brown spots, age spots, liver spots, and red spots from new blood vessels that form on the skin, as well as little puffy yellow and white bumps around the lips or the eyes.
And can there be white spots too for
Oh,
the sun
absolutely.
damage?
You can lose pigment also, as well as gain pigment.
Yeah, so what can you do to best protect your skin from sun damage?
Well, number one, try to avoid direct sunlight when you can, especially if your shadow is shorter than you are. Wear a broad-brimmed hat, 2 inches wide at least. Lightweight skin protective clothing, or seek the shade. And your last line of defense, sunscreen. Yes, a sunscreen of number 30 SPF is a goal. The problem is the average American only puts on a quarter to half the thickness they need to get it. So to get a 30 protection, most Americans need to wear a 60 or 120.
Oh, because we're just not applying enough of it.
Correct.
And you need to reapply if you're out for a while, right?
Correct. Every 2 to 4 hours, depending on how wet you are.
2 to 4 hours. Now, you hear about people getting base tans. Is that just a bad idea?
It is a bad idea because a tan is a sign that skin cells have died. So a tan provides you the sun protection of a sunscreen of 2 or 3.
Okay, so really not doing much.
No.
Now, let's talk about skin cancer. There are different types of skin cancers. What are kind of the different ones?
Sure. There's over 5 million a year in the United States. 4 million are called basal cell carcinoma, over 1 million squamous cell, and about 100,000 are melanomas. And every 24 minutes in America, 1 patient dies of them.
Wow. Now, how can we treat these different skin cancers?
Well, the shallow ones can be treated by a cream, small ones by scraping off, some by merely cutting out and sewing together, but ones on the face, large, aggressive, or recurrent ones, the Mohs surgery procedure that I do, where I'm both the surgeon and pathologist, gives you the highest cure rate, 99% for 5 years, while removing the least amount of normal skin.
And it's serious skin cancer. You need to get it checked out and investigate it if you have it.
Especially the rapidly growing large ones. They can eat away a large area of normal skin that we want to keep normal for you.
When should someone know, okay, now's the time to go to the dermatologist. I need to get this checked out.
If you have a new spot, if you have a spot that is an open sore and hasn't healed within a month, and finally, if a spot looks different than anything else on your skin.
All right, definitely want to get that checked out. Dr. McGovern, thank you so much for coming in.
You're welcome.
You can find out more about Fort Wayne Dermatology Consultants by calling the number on your screen.